The TearCare system from Sight Sciences is the only wearable and fully customizable treatment technology designed to address the underlying cause of dry eye disease by working in conjunction with the blinking eye. In a healthy eye, tears continuously flow onto the eye to protect and lubricate the ocular surface. Normal tears are composed of three components: an inner mucus layer, a middle aqueous layer that moisturizes and protects the eye, and an outer oily or lipid layer that provides lubrication and reduces tear film evaporation. This outer lipid layer is produced by the meibomian glands located on the margin of the eyelid. There are 25 to 40 glands in the upper eyelid and 20 to 30 glands in the lower eyelid. When healthy, these glands express oil with each blink, and the moving upper eyelid then pulls the expressed oil over the tear surface, coating and protecting the eye. If meibomian glands are obstructed, inflamed, or unable to express healthy, clear oil, the outer lipid layer of the tear film is compromised, leading to rapid tear film evaporation, also known as evaporative dry eye. 86% of all dry eye disease is believed to have an evaporative component, yet most of today's available treatments don't address the underlying cause of this type of dry eye disease. The TearCare system is the only wearable and fully customizable technology which allows the patient's eyes to remain open and blinking during the procedure. The system is comprised of 4 key components which allow for a fully customizable experience. First, a reusable software-driven smart hub that provides a tailored delivery of electrothermal energy to the meibomian glands through an intuitive feedback system. Second, a smart hub charging nest, which provides seamless recharging between procedures. Third, a single-use treatment assembly consisting of a flexible pair of eyelid devices that gently conform to the unique contoured anatomy of each patient's eyelids and deliver a sustained thermal treatment to the target tissues. And lastly, a sterile, single-use meibomian gland clearing instrument which allows the eye care provider the freedom to evacuate the glands. Multiple temperature sensors are embedded in every eyelid device. These communicate with the smart hub several times per second to ensure the delivery of consistent and tightly regulated thermal therapy to the meibomian glands throughout the procedure. Each eyelid device is engineered to be soft, lightweight, flexible, and customized to provide an optimized patient experience. To perform an in-office TearCare procedure, the eye care provider, taking care to overlay the meibomian glands, applies the single-use eyelid devices to the tarsal plates of the upper and lower eyelids. Next, the provider turns on the smart hub and presses the start button. Once the thermal elements reach a minimal therapeutic temperature, the automatic temperature control is engaged. This gradually raises the temperature of the eyelid devices to an optimum level over the course of 2.5 minutes. The Smart Hub provides a staged, software-regulated temperature ascent intended to maximize patient comfort. At any point, the eye care professional may manually lower the temperature of the eyelid devices. The specially designed eyelid devices enable an open-eye application of thermal energy directly to the outer surface of the eyelids and into the underlying meibomian glands. This patented open-eye feature is critical. It is intended to not only enhance the patient's experience throughout the procedure, but also allows the eye's natural blinking force to help clear glands during the procedure, when oily obstructions are in a liquid state and can be more easily cleared. After the procedure, the provider gently removes the eyelid devices from the patient's eyelids. Following the eyelid thermal treatment, the provider manually clears any residual gland obstructions using the TearCare meibomian gland clearing instrument that is provided with each pair of eyelid devices. The eye care provider has the freedom to tailor additional meibom clearance to each patient's unique eyelid anatomy and clinical situation. Following the TearCare procedure, Unobstructed meibomian glands may resume releasing lubricating oil onto the ocular surface and tear film with each blink. The TearCare system, the only wearable and fully customizable treatment technology designed to address the underlying cause of dry eye disease by working in conjunction with the blinking eye.